possibly ugly fight shaping up on Capitol Hill this week as looming cuts to Medicare could have serious consequences for seniors. The cuts are due to kick in at the end of the month unless Congress acts to push them back, and the cuts could lead some doctors to start dropping patients. Brad Blakeman is a former deputy assistant to President George W. Bush, and Dick Harpootlian is the former chairman of the South Carolina Democratic Party. Gentlemen, welcome to you both.
Thank you.
All right, the Debt Commission is talking about these issues, looking forward to where we're going. David Cote, I thought, was interesting. He's the CEO of Honeywell. He's one of the private sector guys who's on the panel. He said with the baby boomers going through Social Security, Medicare, Medicaid, all those things, it's going to crush the system. So before we even look at what's going to happen maybe in the next month, do we need to be looking overall at the program and what it could be long term? Brad, I'll start with you.
Absolutely. Look, there was a report in 2006 that stated quite matter-of-factly that Medicare was going to go bust by 2018. Why in the world did Democrats create a global crisis in America on health care instead of targeting the health care they're delivering now that is not working for the benefit of those intended? It's a mandated program, and it's about to go bust. So what are they going to do? Now they're going to give medical coverage to all Americans in the same substandard and inefficient way that they do with the delivery of Medicaid and Medicare? I don't think so. And this is what got doctors so upset. And this is the crisis that we have to meet immediately, Medicare and Medicaid.
All right, so Dick, let's talk about this more pressing, more recent deadline that we're going to hit. And doctors may lose a good chunk of what they would get in reimbursement for treating Medicare patients if this program isn't extended, if there isn't a fix. With doctors saying they may turn away, it could turn out to be some 46 million elderly or disabled patients. Do you think anybody's got an appetite to actually get something done on this in D.C.?
Well, I think that this is a long, as Brad just pointed out in 2006, it was pointed out this program was going to go bust, even as the Bush White House increased Medicare benefits, Brad, if you remember correctly. We've been on a freight train heading for disaster for a long time. Now, it's fascinating to me. I want to hear what the Republican solution is to what's going to happen next month. Is Rand Paul going to want to increase taxes? Is Rand Paul going to throw these old people out into the street? What is the Republican solution to this problem? Because Democrats are talking about tying, eliminating the Bush tax cuts to people that make over $1 million. Their taxes would go up. Everybody else's would remain the same to pay for these kinds of things. $1 billion a month. Where does it come from, Brad? Where do we get that $1 billion?
I tell you, well, you know what your president said as a candidate? He said he would make drastic cuts to Medicare in order to pay for his new health plan. $800 billion in cuts to an already existing program that's going to go bust, Dick. What we got to do is solve the problems for the health care we deliver now and scrap this health care bill, which is a disaster. What we need to do is get to the heart of the problem, deliver the health care we promised to seniors, but do it in an efficient way. And there are costs that can be cut there to bring down the costs and not drive doctors out of the Medicare program, and also increase the amount of patient load, which, what does it do? It reduces the efficiency of the health care they're supposed to provide.
Well, Dick, you mentioned Senator-elect Rand Paul. I asked him that question yesterday because obviously he is against taxes. He's one of the Tea Party guys. That's one of their top line issues. So I asked him about that and where this other money is going to come from. And he says there are cuts to be made across the board, including the military, something that's not always popular. Do you think there is waste within the system that could be cut, or is that just a talking point?
Well, I think there's tremendous waste in government. There's no question about it. And just as private employees are having to do with having salary cuts and less employees, we're going to have to do the same thing with government. There's no question that there's an appetite for that on both sides of the aisle. The question, however, of today's topic is, what do you do about Medicare? It's going to 23, 24% cuts into what doctors get paid, millions of elderly people not getting services. December 1, we got 3 weeks to do something about it. And Brad, we all want to do something about long-term health care, but here we are again at the precipice, and I want to know what Jim DeMint and Rand Paul and the rest of these folks, the Republican revolution of 2010, what they would do in the next 3 weeks, not the next 3 years. What do we do? Not slogans. What's the solution?
Brad, I'll let you take that.
what you're doing is you're putting a gun to Republicans' heads when, Dick, don't fool the people. You control the lame duck session of Congress. You guys are in control with supermajorities of the House, the Senate, and the presidency. There's very little Republicans can do in 3 weeks, and you know that. You guys are in control. You were asleep at the switch, and you made a fatal flaw in your policies. You created a bigger problem in health care than the problem that existed, and that's why you guys got booted out.
See, there's the problem. There's not a single idea there. Brad, what do we do in the next 3 weeks? What do we do?
What do? You guys are in control. There's very little Republicans can do. You think you're going to take our plan? You really think Obama's going to sign off the Republican plan? No. I don't think so.
Gentlemen, I think
maybe we ought to try. Maybe this bipartisan. Let's reach across the aisle, Brad.
Yeah.
Reach out. Let's try to do something together.
Okay, we'll see if the two of you can do it and if they can do it in Washington. Brad and Dick, great to see you both. Thank you, gentlemen.